very special people, radiopharmacists, chemists, creating these or building these molecules. So in the last 10 to 15 years, maybe, there was quite a bit of push in terms of radiopharmaceutical research. And this is why we are now getting this push in nuclear medicine and in theranostics, because several molecules came onto the market, were partially commercialized, for example, being made available more broadly and widely internationally. And these radiopharmaceuticals are produced in, radiopharmacy labs, for example. So chemists, radiopharmacists, they are working there. They are producing in a highly specialized way these molecules, linking it with the emitters, and then we are getting it delivered. So when we are asking, for example, okay, today we have, 20, 30, 40 patients on the PET-CT with these and these and these tracers, they are figuring out, I have to start producing that usually very early in the morning, actually, to get it like shipped to the certain sites or to our imaging facilities at 8 o'clock in the morning, so that the first patient can be injected at 8:30, for example. Because there are certain half-lives of those tracers, they don't last all the same time. It has to be very specific on timing, and you have to produce the exact amount in the morning so that it lasts until the time point when it is injected.
Oh, so it's like these Loblaws chicken, which you have, the expiry date is that day afternoon. So you can't have the tracers lying around for a couple of days.
No, you can't. So there are tracers which you can have lying around for a couple of days because they have very long half-lives. The usual ones, which are used in normal clinical routine, let's call it that way, they have relatively short half-lives, 1-2 hours, this range. These radio tracers, which we are getting mostly at least, we produce them ourselves in our radiopharmacy. So if you're ever interested, we can, or the colleagues down there can show it to you. It's very impressive. It's like with a clean room and a lot of machineries in there, a lot of robotic arms because you can't reach yourself in there, for example. And a cyclotron is down there as well. For example, cyclotron is a big machine where you fire particles on another molecule, for example, so that it becomes actually radioactive. So you have to go through very thick walls of concrete, for example, to get to the inner core. It's very impressive. So it's like big machinery which is being used to produce those radiopharmaceuticals.